Okay, we're going to start talking about medications for various mental health conditions. So in the first one, we're going to talk about antidepressants. Now, this is a bit of a beast because there are quite a few different categories. So we're going to try to demystify this a little bit for you for the three most common antidepressants and give you the most important points that you need to know. So the big thing to know is that these medications work on various neurotransmitters to help improve mood. So the three types we're going to talk about are selective serotonin reuptake inhibitors, or SSRIs, tricyclic antidepressants, or TCAs, and monoamine oxidase inhibitors, or MAOIs. Now, there are also others. There's, for example, an SNRI, which is serotonin norepinephrine reuptake inhibitor. But for this case, these three are the ones we're going to talk about. So let's just review neurotransmitters quickly. They are chemicals within the nervous system that help to transmit certain signals throughout the central nervous and peripheral nervous system. So what you need to know here is that the more neurotransmitters that a drug works on or influences, the more dangerous or risky the medication is. So some common neurotransmitters we'll see being worked on are serotonin, which I like to call the happy hormone, norepinephrine and epinephrine, which are catecholamines involved in the fight or flight response, and dopamine, which is involved in a few things, motor movement. It's also the reward neurotransmitter. Okay, so let's review just some general things that you need to know, and then we'll break each of the three drug classes down. First, know that it could take 2 to 4 weeks for these drugs to be at therapeutic levels. So make sure the patient knows they may not feel better right away. It's also super important that they don't stop abruptly, but that they taper down these medications if they're needing to come off of them. Otherwise, they could experience withdrawal symptoms if they come off too quickly. It's also important to know that there are a lot of drug interactions with antidepressants. So make sure that you are looking at that patient's med list and their med history. There's also an increased risk for suicide after starting an antidepressant. Why is that? Well, they're going to start to feel better after a week or two, but some of those thoughts of suicide might still be present. So now they have more energy and they feel better, but it's almost like they end up with more motivation to go ahead and end their lives. So make sure that you are looking out for signs of that. Review the suicidal behavior lesson to learn more about how to identify that. Now, the other thing to know is these drugs can have some sedative effects. So use caution with alcohol, use caution when driving, and in the elderly, things like that. They may also be a fall risk. So remember also that therapy used in conjunction with medication is really beneficial. So make sure that you're promoting that and educating your clients on the importance of therapy. So SSRIs, selective serotonin reuptake inhibitors. They inhibit the reuptake or the absorption and use of serotonin. So if the serotonin isn't being taken up by the cells, then the serotonin levels within the bloodstream are going to be increased. Now remember, serotonin is the happy hormone. So that's going to help to elevate mood. So some possible side effects are weight changes, depending on the patient, decreased libido, dizziness, and photosensitivity, which is a sensitivity to light. Now, the big risk for SSRIs is serotonin syndrome, which occurs when serotonin gets to toxic levels. So this has a rapid onset of tachycardia, shivering, hallucinations, and can progress to coma and even death. It's really important that you are aware of this risk and watching your patient for symptoms. The treatment that we do is a serotonin antagonist. Now, you'll notice that SSRIs only affect one neurotransmitter, okay? So they are relatively safe and they're considered to be first-line antidepressants because of that reason. So this is things like sertraline, which is Zoloft, and fluoxetine, which is Prozac. So some of the more common ones. Moving up from here are TCAs, or tricyclic antidepressants. These drugs are going to increase both serotonin and norepinephrine levels. So 2 neurotransmitters, a little more risky, right? They do have some sedative effects, so be cautious there. They can also have cardiac effects. Remember, norepinephrine is part of that fight or flight response, so watch for arrhythmias. And then with TCAs, we also see anticholinergic effects. It's the 4 can'ts. Can't pee, so urinary retention. Can't see, so blurry vision. Can't spit, so that is the dry mouth. And can't, constipation. Remember that cholinergic is your rest and digest. So anticholinergic is they don't rest and they don't digest, okay? So you can imagine now having serotonin, which is the happy hormone, and norepinephrine for fight or flight, and these anticholinergic effects is going to really pick somebody up from depression, right? But with multiple neurotransmitters, it can be risky. So they're at risk for seizures and they're at risk for cardiac arrest, especially with overdose, okay? And then, of course, remember to look for those drug interactions because that can just potentiate this effect and increase the risk. Okay, the last one we want to talk about is MAOIs, or monoamine oxidase inhibitors. These are our last resort antidepressant that we only use if the others just don't work, because they work on multiple neurotransmitters and have multiple drug interactions. So we'll see alterations to serotonin, melatonin, epinephrine, norepinephrine, dopamine, and tyramine, and more. So in terms of drug interactions, if you give opioids with MAOIs, there's a risk for coma, seizures, and blood pressure derangements. If you give MAOIs with vasoconstrictors, nasal decongestants, dopamines, other antidepressants, amphetamines, or tyramine-containing foods, they're at risk for hypertensive crisis, okay? Now, I did highlight this for you, tyramine-containing foods. This is big. You're going to see it on tests, and you're going to see it in real life. So foods that contain tyramine tend to be cured meats like lunch meats, bacon, cultured dairy like cheese and yogurt, wine, and things that are fermented like sauerkraut. So I've put a longer list in your outline, so make sure you check that out. This is so significant, this risk for hypertensive crisis, that we actually recommend that patients who are taking MAOIs wear a medical alert bracelet that either says MAOIs or has an allergy to tyramine, one or the other, or both, because healthcare providers and first responders need to know. So let's recap. The more neurotransmitters a drug impacts, the more dangerous that medication is. For SSRIs, you need to know about serotonin syndrome and the risk for that, which can be life-threatening. For TCAs, make sure you recognize these anticholinergic effects and the cardiac effects. So know the 4 can'ts and make sure you get an EKG before you administer it. For MAOIs, just remember that there are a lot of drug interactions and they're usually our last resort medication. Make sure you know the foods that contain tyramine because they can cause hypertensive crisis. And finally, just remember that it takes time for them to work, so we need to keep monitoring for suicide risk and suicidal ideations. And remember that they must be tapered down. They should not be stopped abruptly.
Thanks for watching another nursing.com lesson. Click the link below in the description to watch thousands more lessons over on nursing.com. Also, be sure to hit the subscribe and the little bell to make sure you're reminded when new lessons come out. And if you want to just keep watching more lessons, go ahead and click this video over here to continue learning. Like we always say here at nursing.com, happy nursing.